Welcome back to The Explainer. We've all been there, right? You're just going about your day, and suddenly a rogue eyelash falls into your eye. It is absolutely maddening. That tiny, practically invisible little hair suddenly feels like a jagged shard of glass. But, for most of us, a few blinks or a quick flush at the sink, and the nightmare is over. Keep that deeply frustrating sensation in mind for a second. But now I want you to imagine that the eyelash isn't just a fallen stray. Imagine it's actively growing directly towards your eyeball, constantly scraping against the surface every single time you blink. Day after day, week after week. That is the relentless, escalating medical reality of a condition called trichiasis, which is exactly what we're breaking down and demystifying today. Okay, let's dive into this. Here is our roadmap for today. 1. The eyelash nightmare. 2. Finding the root cause. 3. Zapping and freezing lashes. 4. Surgical solutions. And 5. Prevention and the safe strategy. All right, kicking things off with Section 1, the eyelash nightmare. So what exactly is trichiasis? Well, the medical definition is simply the misdirection of eyelashes, or ingrown eyelashes. But it doesn't just happen out of nowhere, right? It's triggered by underlying issues, things like infections, intense inflammation, certain autoimmune conditions, or even direct trauma, like a burn to the face. The real danger here is entirely mechanical. These offending eyelashes just constantly rub against the incredibly sensitive surface of your cornea. And because the cornea is absolutely packed with nerve endings, that constant friction is literally agonizing. Now, doctors actually have to be pretty careful here to distinguish trichiasis from another condition that sounds kind of similar, and that's discomfort. While trichiasis is a normal lash that's just pointing the wrong way, discomfort is actually the presence of an entirely separate extra row of soft lashes. And these grow right out of the meibomian orifices, which are those tiny oil glands right on the edge of your eyelid. It's wild because discomfort can actually be congenital, meaning, someone can literally be born with a whole extra row of eyelashes, or it can be acquired later on through severe lid inflammation. Regardless of whether it's a misdirected lash or a whole extra row, the symptoms are severe and man, they escalate quickly. It starts off with simple irritation and what doctors call a foreign body sensation, basically that annoying feeling of something being stuck in your eye. Then comes the reflex watering. But if it's left untreated, the friction literally starts wearing away the surface of the eye, leading to superficial corneal erosion. In the absolute worst cases, this constant scraping causes corneal ulceration, which can permanently threaten a person's vision. It's a terrifying escalation from what is essentially just a misplaced hair. Moving on to Section 2, finding the root cause. When doctors start investigating this, they immediately run into some pretty heavy medical jargon. They have to play detective and systematically rule out other issues. They're looking for things like lid entropion, where the eyelid actually folds inward, along with epiblepharon, lid scars, and cicatricial conjunctivitis. It's intense work because they have to make absolutely sure they aren't just treating a symptom, but are actually addressing the structural or medical root of the problem. But, when we zoom out to a global perspective, the root cause takes on a massively broader scale. In specific endemic regions, particularly areas in India like Punjab, Bihar, Haryana, and Rajasthan, one of the absolute most common causes of this condition is an infectious disease called trachoma. And because the root cause here is an infection, the treatment protocol is rigorous. Just think about this contrast for a second. For a condition caused by a tiny eyelash, the protocol demands a heavy antibiotic regimen. We're talking a 1-gram azithromycin tablet combined with a topical tetracycline eye ointment, applied twice daily for 6 straight weeks. It is an incredibly aggressive routine to fight a very stubborn bug. Let's move to Section 3 and see how this builds. Zapping and freezing lashes. Now, what's really interesting about this is the sheer intensity of the medical arsenal used against something as small and delicate as a single eyelash. We are talking about mechanical epilation, electroepilation, cryotherapy, and argon laser cilioplasty. It's almost hard to believe we use high-tech lasers and electrical probes delivering energy straight into a hair follicle to cause chemical or thermal destruction. But honestly, that is exactly what's required to save the patient's cornea. Now you might be wondering, why not just pluck the hair and be done with it? Well, that's exactly what mechanical epilation is, but there is a massive limitation. If you just pull the lash out, it's going to come back fast. Recurrence is basically inevitable. The patient will literally have to come back every 3 to 4 weeks to have it plucked again. So it's a temporary Band-Aid, definitely not a cure. So, for a much more permanent solution in cases of segmental trichasius, doctors bring out the big guns: cryotherapy. They literally freeze the follicle to death at a cellular level. It's a highly precise, rhythmic process. First, they use a nitrous oxide probe to apply a deep freeze for exactly 25 seconds. Then they let the tissue completely thaw. And finally, boom, they hit it again with a 20-second refreeze. This double freeze-thaw technique totally destroys the hair-barren follicle. That hair simply cannot grow back.
Which brings us to Section 4, surgical solutions.
Because sometimes freezing and zapping just aren't enough. And this brilliantly illustrates just how intense the surgical options get. For tracheomatous scarring in the upper lids, a surgeon might perform what's called a bilamellar tarsal rotation. Or, remember that extra row of lashes we talked about earlier? To fix that, they might literally split the eyelid in half to expose and individually cut out the follicles. In the most severe cases, they'll even do a full-thickness pentagonal resection. That means literally cutting a pentagon-shaped chunk out of the eyelid and stitching the remaining pieces back together. No way around it, it is major surgery. When doctors perform these intense surgeries in regions where the infectious trachoma is the underlying culprit, they use a specific approach known by the acronym STAR. That stands for Surgery for Trichiasis and Antibiotics to Prevent Recurrence. It perfectly highlights the two-pronged attack you absolutely need here. You have to physically fix the eyelid and remove the lashes surgically, for sure, but you also have to medically eradicate the underlying infection with antibiotics. If you skip that step, the whole nightmare is just going to start all over again.
Finally, let's look at Section 5, prevention and the safe strategy.
In hyperendemic areas, health education actually becomes the most critical weapon we have. The global strategy is built around another, even broader acronym, SAFE. This stands for Surgery for Trichiasis, Antibiotic Treatment, Face Washing, and Environmental Improvement. It's just a brilliant, holistic approach. You treat the immediate, painful medical crisis with clinical measures like the surgery and antibiotics, but then you tackle the societal root causes through foundational measures like face washing and environmental improvement to stop the bacteria from ever spreading in the first place. So the crucial point here is that this isn't just some isolated clinical effort. The World Health Organization actively champions the SAFE strategy all over the globe to control this specific infection responsible, which is called C. trachomatis. It's a massive, highly organized global health initiative, all targeting an infectious chain of events that, if left unchecked, literally ends with a single eyelash destroying a person's sight. It really forces you to step back and look at the human body, and global health for that matter, just a bit differently, doesn't it? I mean, if a single tiny misdirected eyelash can require intense microsurgery, double freeze cryotherapy, heavy antibiotic regimens, and massive global health strategies championed by the WHO just to prevent it, what other tiny, seemingly insignificant bodily anomalies are we completely underestimating right now? Definitely something to think about. Until next time, thanks for joining me on this explainer. We'll see you in the next one.